Hello, friends. Welcome to another episode of Listen, Learn, Live Better with Sushmita, my health podcast show every Saturday. Today's episode, or the topic that I'm going to talk about, is understanding seizure and epilepsy. The term that no one wants to discuss. The patients feel that a little shy or introvert to discuss this topic. So, today's topic I have chosen is to make everyone understand out there about what is seizure and what is epilepsy and how to tackle the situation. So first thing first, we must know what is epilepsy. Epilepsy is a long-term chronic disease that causes repeated seizure due to abnormal electrical signals produced by damaged brain cells. A burst of uncontrolled electrical activity within the brain causes a seizure. Epilepsy is also called a seizure disorder. Now, what is the relationship between seizure and epilepsy? Epilepsy is characterized by recurrent seizures, but not all seizures indicate epilepsy. So understanding the relationship, we can just, very important it is to diagnose and for the treatment of either epilepsy or is it a seizure. A seizure is the event, whereas epilepsy is the condition of seizures that spontaneously come back on their own. Therefore, it is possible to experience a seizure and not having epilepsy. But a person is considered to have epilepsy if they have 2 or more unprovoked seizures more than 24 hours apart. Now, what is a seizure? A seizure varies from person to person depending upon their seizure types. That's because epilepsy is a spectrum disorder like autism, meaning the causes, type, and severity can greatly differ between person to person. Now, some people may have visible symptoms, others may not have any visible symptoms. Understanding the symptoms of seizure. The signs and symptoms of seizure will vary from person to person, as well as the type, severity, and phase of the seizures. General signs that we often see are unusual behaviors or sensations, uncontrollable movements of the limbs, and loss of consciousness. What triggers a seizure effect? Seizure triggers are events or something that happens before the start of the seizure. Commonly, the seizure triggers include stress, sleep issues like sleep disturbance, alcohol use, alcohol withdrawal, recreational drug usage, hormonal changes, illness or fever, flashing lights or patterns, unhealthy food habits, physical overexertion. Specific foods like caffeine is a very common trigger. Dehydration, certain times of the day or night, use of certain medications, and missed anti-seizure medication doses. Now, if a person has a seizure, what are the tips for the recovery of the seizure? It's a good idea to speak to the doctor. Very, very important. Always speak to the doctor if you come across any episode like that. While everyone is different, but the common challenges that comes with the seizure are commonly the lip or the tongue biting. There may be ointments or gels to prevent that. Then the mouth can be rinsed with saline water. After that, anxiety and sadness also comes after a patient has a seizure. Remember, which is not uncommon. So, professional support is very necessary. Forgetfulness during the recovery period, like set reminders for important tasks because you may forget after that seizure effect. Difficulties getting back to work or study. So professional help is needed for that. Concerns about repeat seizures. Will I have another seizure effect? Another attack? So ask a family member or a trusted friend to check while the patient recovers. This is particularly important if the patient is living alone. And exhaustion following a seizure or seizure cluster. So it is a good idea to have a break before you resume more challenging or risky activities, like stay off from the computer or refrain from doing tasks like driving or too much concern that requires alertness. So these are some of the tips, basic tips to recover from seizure. Now, after a seizure, your doctor or the healthcare professional will be the best person to let you know how to go forward with that and what are the treatments and other measures that can be taken. Yes, the question that next comes to our mind is, can we prevent seizures? How to prevent seizures? Any person can have a seizure. People who have had 2 or more seizures without an identifiable cause are at a higher risk for additional seizures. So, what you have to follow to prevent the seizures if you or any of your family friends or your own friends have this. So how to just advise them and how to prevent seizures. Number 1, all the medications as prescribed should be taken in time. Number 2, sleep. Lack of sleep, as I said, is a big contributing trigger for seizure. So just have a sleep pattern for about 8 hours per day. And it is very important to get good sleep. Eat regular healthy meals. Skipping meals can lead to hypoglycemia, where your blood sugar may drop suddenly, which can trigger seizures in some people. Eating meals at regular times, at regular intervals, is very important. Avoid the use of excessive alcohol or drugs. Just try and prevent the excessive use of alcohol or drug, which is a seizure trigger. Exercise regularly to keep yourself healthy and fit. Pay attention to fevers. It is that seizure, it puts a people at a high risk of having seizures if the temperature, just body temperature goes high and during high fevers. The patient may experience, not always, may experience seizures due to high fever. So just keep a watch out for high fevers and avoid flashing lights. Flashing lights are commonly seizure symptoms triggers. However, they actually only impact about 3% of the people. But if you know that you have a photosensitive epilepsy, you need to limit exposure to flashing lights. Suppose you see now someone suffering from seizure. You are scared how to take control of that situation. So now I'm giving it some of the tips for that. How to keep someone safe during a seizure. Keep yourself and others around calm. Don't get excited. Stay with the patient always. Remove anything near him that can cause an injury due to uncontrollable limb movements. Check to see if the patient or the person is wearing any medical bracelets for information about their medical conditions. If the person is lying down, turn them gently on their side with their mouth pointing to the ground. Why? So that the airway remains clear and they are not choked. Time the seizure to track if it lasts more than 5 minutes, if it does. But if it also does not, call 911 for detention. When the seizure is over, help them sit in a safe place to recover. Once they are alert, comfort them and explain what happened calmly, and offer to call a friend or a loved one to help them get home safely. Other steps that you can also take are, these are some of the generalized tips that I'm giving every one of you over there. Generalized seizure affect both sides of the brain and may cause the loss of consciousness. When a person has a generalized seizure, they can fall down, shake or jerk their body uncontrollably, twitch in body or eyelids, become unaware of what's around them. So, if you see someone, as I told you, some of the steps, if you see someone already standing and just going to have a seizure, just ease them to the ground if they appear to be falling down. Okay? Take off their eyeglasses so that they don't injure their eyes during that seizure moment. Always call 911 wherever you are to help them out. When to call for help, as I told you, you see all the symptoms, call 911 immediately. Don't wait for anything else. Don't take these actions. No. These actions, if you see a person having seizure, don't hold the person down or try to stop their movements. This could injure you and also them. Don't put anything in their mouth, just water, no. They can hurt their teeth or jaw and may also choke. Don't give CPR, mouth-to-mouth breaths during the seizure time. People usually start breathing again on their own after a seizure. Don't offer water or food, as I told you, nothing by mouth, until they are fully alert and sitting down. This is not necessary and could cause them to choke. So this is just a very baseline topic that I discussed today about seizure and epilepsy. What is the difference? How to take care? How to help someone who is having that episode of seizure? And what are the actions that we should not take when a person is having seizure? Epilepsy may be hard to live with, but it's how you deal with it that makes all the difference. Thank you for being with me in today's episode on seizure and epilepsy. See you again next week with another episode of Listen, Learn, Live Better with Sushmita. Have a lovely day ahead. Take care of yourself. Stay safe. Stay healthy. Bye for now.